2025 was really an unprecedented year for healthcare fraud investigations and prosecutions, particularly by the federal government. The Department of Justice has really made a priority of doing full investigations and prosecutions of healthcare fraud across all 50 states. They've used a dedicated healthcare fraud unit, which collaborates with the Office of Inspector General, the postal inspectors, the FBI, the DEA, to root out primarily Medicare and Medicaid-based frauds. And I think what 2025 has shown us is that the perpetrators of many of the fraud schemes that cost taxpayers millions, if not billions of dollars, have gotten more and more sophisticated, have used multinational groups to effectuate these schemes. The Department of Justice's use of AI and the sort of computer-related mass data and analytic tools to root out fraud schemes has really been unprecedented and pretty amazing to watch. Just this year, we've seen over 300 individuals arrested and prosecuted in federal courts across the country. Almost $14 billion in intended loss is represented by these cases. And much of it was fueled by the investigators' use of tools to look at trends in billing, in coding, in the use of different people's identities to effectuate these schemes. And I'll give you a couple of examples that are pretty interesting. One group was indicted for what amounts to essentially phantom billing, where the use of call centers was used to get individuals' identities, people who were qualified under either Medicare or Medicaid. Their identities were then taken and phantom billing was done to either Medicaid or Medicare in the amounts of billions of dollars, billions. And the analytic tools employed by the federal government allowed the investigators to go out, find the patients, identify the fact that these people had no idea this was happening, and ultimately put a stop to it. 5 years ago, you wouldn't have seen this. 5 years ago, it was boots on the ground. You would see some analytics with the use of codes within certain geographic areas, but you didn't see national trends. Everybody knows with ChatGPT or the different AI services, you could put in a little bit of information and get an enormous amount of results. If you put in a more significant amount of information, you get almost an unfathomable amount of results. And in this space, I think what the government has done is they've taken large amounts of information from closed databases, the Medicare and the Medicaid units, and fed that through analytic systems to identify what they're seeing as patterns or trends that are outside the norms. And it's pretty high-level stuff, and it seems to have resulted in literally billions of dollars of fraudulent claims that were not ultimately paid.